All right, we'll go ahead and call the Monday, September the 28th, 2009 Public Safety Committee to order, and I'll entertain a motion to approve the minutes of last month.
So moved.
Second.
Got a motion and a second. All in favor of the motion say aye.
Aye.
All opposed, motion carries. First on the agenda is Smyrna Rescue Squad. Don't see them in the audience. Next will be the juvenile detention. And I believe the report is on the desk.
Yes, sir. All right, this is the usual report that you're familiar with. Probably the only thing of interest is that we had low numbers for the month of August, but we're okay with that because it gives us time to catch our breath and do a little bit of the stuff that we had to put to the side during the busy months. So if you have any specific questions, I'll be happy to answer them. We have 3 counties that currently owe money. None of them are we concerned about. We usually get those checks after we have this meeting.
Okay. Does anybody have any questions?
Got your new employee working out.
Which one?
You said you had stole one from another
Oh,
department last time I was
she's
here,
working
so-
out great. We actually are in the process of doing some hiring, so I didn't know which one he was talking about, but she's working out great.
Anybody else?
The hiring, is that filling vacant positions?
We have several employees who are moving out of state, and so we are doing some internal promoting and then backfilling those positions.
No new positions.
Oh, no.
Are they being advertised on the Rutherford County channel?
I believe so, and I think that it's also on the internet.
Anybody else? I'll entertain a motion on the report.
Motion to approve the report.
Motion and a second. Any discussion on the report? Hearing none, all in favor of the motion say aye.
Aye.
All opposed, motion carries. Anything else?
That's it.
All right, thank you.
Thank you.
OSHA report, nothing gets on your desk.
For the OSHA report for the month of August, we had a total of 34 claims or injuries that required medical treatment. Of that, for the year to date, we have 170 total, and you can see the breakout. That's how they break out as you go down through there. As far as the recordable under the OSHA, there's 117 that were recordable year to date. 38 of those claims had restricted days on it. 28 claims had lost days. And then there were a total of 51 other claims. If you look,
What's the 51 others?
they did not have any lost time or restricted days, but under OSHA regulations, they are recordable, so we recorded them. On the next page, you'll notice you'll get to see the graph comparison. We have been up the last 3 months, and of course, if you look, you'll see that we're up this month also. I checked with our TPA, our third-party administrator, and talked to them about it. They have a number of clients, and they've said that their clients, all of them, are experiencing an uptick in reports at this time. There cannot be anything really that they can touch on that says why. I mean, there's a lot of speculation, whether it's the economy, things that are going on, or what. We really can't say, but it's not unusual. She said, according to them, we're in the pack with the rest of them for some reason, but there is an uptick going on.
Obviously, we really don't care about the rest of them from the
Oh,
standpoint of where we are.
I understand
When
that.
I look at this, and it's the highest recordables that we had last month that we've had in the last 2.5 years. And 2.5 years ago is when we started, really first started with safety programs.
I would like to say, of those in that month, there is one area that had a detention that had an incident, and in that incident there was 7 injuries from one incident that was reported. So because of one incident, there were 7 claims out of
Wasn't
that
that last month?
in the month of August.
What was it?
The sheriff.
I don't think, to be honest with you, I'm not trying to hide anything about it. That may be a situation where we probably don't need to be discussing because of potential lawsuits?
No, it's
Well,
not
then
necessarily to
they
do with
would.
that, but that is private information for those individuals.
Well, I just didn't want to go into something that might be a
Understood.
potential, problem for
There
us.
are ways to summarize that, though,
Okay.
that you don't have to
Okay,
go by names and.
okay. Ever had?
Yeah. Well, the one incident is because if individuals are exposed to different types of pathogens, then they are recordable, and then if the person gets a pathogen exposure, then they're required to seek medical attention, and we forward them to the medical provider to get that attention.
Okay.
So we had 7 individuals in one incident that happened with.
Okay. I just didn't mean, I just want to go somewhere that
Absolutely.
we probably didn't need to go, so, at some point.
For the net dollars incurred for the month of August, it was just under $40,000 at $39,600. And you can see the breakout on the next couple pages over. You'll see the Board of Education had 16 injuries. And you can see how they break out with strains, slips and falls and burns. And then the Rutherford County had 18 injuries. And how that breaks out within the county general that you're looking at there. Was struck, injured by, and motor vehicle accidents.
The burns was all related to cooking.
I beg your pardon? Oh, yes, the burns, yes, in the kitchen area of the schools.
How many was burns?
2.
2.
And most of those are handling hot foods, taking them out of the oven. Or it's a steam burn where then they open the steamer and the steam catches them when they open the steamer.
The increase that you got back here the past 3 months, what's that due to mainly?
To
Slip,
the,
trips and falls?
I'm sorry,
The increase the past 3 months that you were speaking of?
they're basically across the board as a whole. There's not any one general area. Slip, trips, and falls, and strains. Strains are one of the big ones that, again, keep coming up. Unfortunately, in the month of June, the school system was doing a lot of stripping of the floors and re-waxing, and that was up because we had some injuries from the school that we normally don't have as far as slip, trip, and falls. But this year we got them when we were stripping the floors.
Any more questions on his report? Entertain a motion.
Move to approve.
Got a motion, got a second?
Second.
And a second. Discussion on the report. All in favor of the motion say aye.
Aye.
All opposed? Motion carries. I think you got something else.
Yes, I have one other thing. We have had some input to the on-the-job injury program, things that have required us to look at updating the program. One being that the Board of Education and the County General Employee Handbooks have been updated, and we're not in compliance with that on one of the items in here, so we need to rechange the wording. Also, some wording to kind of make it a little bit clearer. We wanted to do that. And also there's been some case law that came out in February after we had already came into the program and adopted this. It came out in February. While we followed the case law, we wanted to put it into the document. So rather than come back and change it immediately, we brought all this together and want to make the changes at this time. And if I could just real quickly run over it for you.
Okay.
On page 2 of the document, in the middle of the page, you'll see where it says FMLA and all other leave policies. That says that they will run concurrently with the OJI program, and that's in compliance with the county and the Board of Education's employee handbook. On page 4, the one at the top of the page, it talks about law enforcement. While we were in the process of getting the initial review from the sheriff's office, one of the things that had come up was that officers and emergency responders diagnosed with heart or hypertension would fall under the OJI program. they wanted, expressed the desire to give the individual an option of whether to be under the OGI program or under the regular health insurance. What that does is allow the individual to then decide if he's under the health insurance, what doctor he would like to go, rather than going to the OJI doctor that would have to be chosen from a panel. So what we wanted to do was include that, and we'd give them the option if they choose such treatment. And if they decide to keep it under the regular health insurance, if this option is not chosen, then the law enforcement officer or emergency management responder, the conditions will be eligible for treatment under the county health insurance program if the individual is so enrolled. And so that gives them the option of doing that instead of just being limited to the OJI program.
So this actually gives these individuals an option to go to their regular doctor instead of going to one that the county is telling them to go to.
Under the
Only
OJI,
for these diseases.
yes.
For
Diagnosed with diseases of the heart and hypertension.
Are they subject then to their deductibles and their
Yes,
co-payments?
they will be.
Just
Under the regular health insurance.
Okay.
But it gives them that option if they so choose.
Does this also give the option to other county agencies that are under the health insurance plan?
It would be strictly the ones that are listed here on the bottom of page 3 where we talk about law enforcement and emergency management responders diagnosed with diseases. So that's where it come back and because of their duties that they perform.
what
Yes.
about it doesn't spell it out, but it may be just on language. It says emergency management responders. The ambulance service. Is that included in that?
Yes. In fact, it probably should say emergency transport people. but-
Or emergency management or emergency medical
Correct.
responders? I mean, because we got emergency management department that responds, we got emergency medical services that respond, and we got the sheriff's department that responds. Is there any, I don't think none of the volunteer fire departments are under, they wouldn't be anything or eligible for nothing like that. I think maybe, is that where you was headed a while ago, Commissioner?
No, I'm just.
But it does give
about
them,
the Board of Education. and
Oh,
there's
okay.
other people that
no, it
are-
doesn't respond to them because they wouldn't fall under those duties.
Explain why there's a difference between emergency personnel on this versus, say, the Board of Education or someone in an office setting.
It's the stress that the individual is put upon by the duties of their job. For example, sheriff department, law enforcement, they're out there on patrol, they get shot at, you're under a lot more different stress on a continuous day. You never know when you respond, and that takes a toll on an individual. So hypertension, heart disease, things like that, it's much more prevalent to those groups of individuals. And so that's why this is written toward them.
So you've never taught a classroom.
In this day and age especially, right?
But
Well, is that something y'all bring past our legal department? I mean,
Well, this-
it looks to
this
me that
document-
we're differentiating between individuals that are under the policy, and I've got a problem with that. I mean, maybe you can explain it to me.
Yeah, the document, the last paragraph on page 3 is probably what you need to refer to. And that's part of the original document that was reviewed and approved and passed through committee and through the county commission. And that was in there specifically for law enforcement officers and, like you said, emergency responders, due to the stresses of their job, that if they were to come up with a disease of the heart or hypertension, then we would presume that it was related to their job unless it can be shown that it's not by competent medical evidence. And this was put in there as actually a good thing for our law enforcement officers and
Well,
emergency responders.
and the reason I asked that question a while ago is, and I assumed that sometimes, when you assume, I assumed that there was some type of law that was required for police, EMS, MA, fire type, when it comes to heart and lung laws and
There are some things.
hypertension and stuff like that.
Yes, and we are covered,
All right.
but it also gives them, yes, but it also gives them the option if they don't want to do it, they can opt out of it.
Right, well, I know what I'm saying though is, and
Oh.
I understand every department district equal as the other, but I was trying to answer that question.
Oh, okay.
Because I thought there was a law from what Commissioner P was talking about a while ago.
There is, that's actually in the next paragraph down on page 4. There's a copy of TCA 751-201B, and that does state in an OJI program that this assumption would be included.
Yeah, the very, very
Okay, all right, that's where I was headed with that a while ago, because I thought there was.
Yes.
But then with feedback from the sheriff's office, they reviewed this document pretty thoroughly, and we did a lot of took a lot of their suggestions to heart, and they requested that they be able to have the choice of whether or not they were utilizing the OJI program for this, or if they would be able to opt out.
So you met with the department heads on these here?
That was
Our
something,
sheriff department.
that was
Yes.
something put in earlier in the year, yes, they asked for.
So it's being put in now.
Well,
We
being
discussed
put in
it.
now,
It
but we
was-
Right.
discussed it.
Okay. All right. Well, that way.
The next change is in item 3 under rules, and we're adding where employees will be responsible for completing and submitting documentation as required by the supervisor. We had an incident where an individual had an injury, they told their supervisor, and that's all they wanted to do. There was no assistance given to the supervisor to help clarify the claim, get the claim submitted, the documentation, and things like that, and yet the employee has a responsibility to do that. And so we needed to spell it out that they do have a responsibility to assist in supporting, providing support documentation in that. So
Right.
that's all that is again, point of clarification. On page 5, item 6, it says qualified individuals shall seek treatment. And what this is under the rules as far as if an individual was to seek treatment then at a non-authorized provider, then the claim would be denied. And what we took out the word seek, and we want to put in receive treatment, because really somebody may go to the doctor and they may say, well, I got hurt at work, and they say, whoa, stop, you need to go to do this and this. Well, just by the fact seeking it, according to the document, it says that would deny the claim. We're not talking about doing that. We're saying that they actually receive treatment. So again, that's a point of clarification on that only. So we wanted to say that.
Has anybody been denied because of that language yet?
No, not because of seek, no.
Okay.
But that's when we realized we needed to change the documentation on that. On page 6 at the bottom, it talked about the Rutherford may require injured employees to submit the drug test under the drug-free workplace with the Board of Education and the county handbook. It does not say may, it says will. So we need to comply with the Board of Education and the county handbook under the drug-free workplace. That's why we changed that to will require.
So anytime anybody gets hurt and gets treatment, they are required to have a drug and alcohol test.
Yes.
And we've been doing that as a matter of course since the program started. That's nothing new. It's just before it said may, and now
And that's every department.
every department.
Do we need a time limit in there?
For the drug test, it's on the first treatment. Yeah, it's on the first treatment. And that way we don't make a judgment call as to if somebody goes in the day of the treatment or if somebody goes in the next day. Everybody gets it. It's consistent with everybody.
No, I think he may be talking, I'm not trying to put words in his mouth, but say for example, someone gets hurt and they wait 30 days to turn this thing in.
They can't.
They can't.
They can't
Exactly. They
because,
have to report within their current working shift.
Well,
and they have,
my incident is just, you have a traffic accident and you have, where you have it, you got to work, somebody has to work the accident, you got vehicles towed and it puts people out. By that time it's 4 o'clock and they got kids to pick up and I really don't have time today, I'll come back tomorrow and I'll do it when you actually need it. At the time
I
of the
understand when
accident.
they need it, but the drug test is taken when they go to get the initial treatment. So and they have up until the first 7 days in order to get that.
So they can have an accident today. 7 days later, they could go for the initial treatment. That's when they get drug tested.
Under the program, yeah.
It's hard to catch any alcohol by then. you
No.
know.
We haven't had that circumstance come up. Generally, people report their injury and go to the doctor.
Yes, but the only thing is if, then I'm forcing them to go just for the drug test without the treatment or something like that. Sometimes somebody may get injured and say, I don't need a doctor, and then, and they report it and done everything, and then 2 days later, they think, well, I need to go after all.
If someone comes in and I'm your supervisor,
Mhm.
you come and tell me, I hurt my hand.
Mhm.
Well, come on, we're going to wherever we're supposed to go. At that time, you've put me on notice. As a supervisor, I have to act.
Mhm.
So, to look at the liability of the county, I'm fixing to have you sent to be treated. At that time, you will also be drug and alcohol tested. Should it happen at that time instead of waiting to go up to 7 days later?
Well, then, what we would get into
You
is,
put me on notice as a supervisor.
Mhm.
It's one of them deals up here, that flag's waving at you. You gotta react, you gotta do something.
the way we've got it put together at this time is when they go to get the initial treatment within the first 7 days. I'm not sure that you could actually, every time somebody reports an injury, require them to go right then if later on they decide, I don't want to seek treatment, if I don't want to get the treatment. And by requiring the drug test at that point, then there may be those individuals that may feel that they don't want to report the injury simply because of that. I mean, there's different things to speculate there.
Why would you even want to give them the test then? You're giving them the test to get a contributing factor to what may have caused the accident.
Mm-hmm.
That's the only reason you're giving them an alcohol or drug test, because if it's a contributing factor, it may have caused the injury.
Well, the other thing would
So why
happen,
even give the test?
well, the other thing, if I put an hour limitation on it and I say, okay, then they've got to do it within the first 24 hours, and if they don't go the first 24 hours, then everybody will hold off after the first 24 hours, so then they don't have to do the drug test then. So then it'll automatically opt out. I mean, they'll hold off reporting the injury or not going to seek medical treatment until after that point then.
But if someone notifies their supervisor that they're hurt,
Mhm.
you know, and don't the county have a liability then? I'm no attorney.
Yeah, and that's the way the program has worked. Granted, the language in here does allow for some movement, but that's how the program has worked so far. When people generally, as soon as they're hurt, they report the injury and they go immediately for treatment. That's what has happened so far. We haven't had anyone that we're aware of anyway that has held out for a few days in order to be
Clean.
a drug test. Yeah.
If I'm not clean, you know, I'm gonna,
Well, there's some, I won't say misinformation, different points of view though. Some individuals will say that if you have a drug test that it'll stay in your system for up to 30 days, and that's what, 30 days. Other individuals and organizations will say that it's only in there for 2 or 3 days, and it really depends upon the drug itself.
if I'm drinking on the job, it's gonna be.
Well, if it's drinking on the job, I think we'll already know that as far as the smell of alcohol and things like that.
But what's your proof? Your proof is the test. I'm a law enforcement officer. I get a DUI, I don't take you to jail and test you tomorrow, and I test you that night.
That's right.
That's my only proof.
Okay, well, I'll
A cocaine charge it's in your system 3 days.
Mhm.
I take you then and I have you tested and I send it off. If I wait 7 days, then I don't have anything in the system. There's my proof. And what your paragraph is stating is a positive drug or alcohol test will result in a cause or condition of the injury, and you will not be payable.
Okay, so I understand what you're saying is that if anybody reports an injury, then they should go immediately for a drug test then. So I'll take that.
Injury or anything. I just feel if you, ambulance service is involved in an accident, that driver ought to take a drug and alcohol test. That's part of your contributing factors that you look at as far as an accident. I do in my
By
system.
state law now. Even
It
before we
is.
initiated
It
this,
is.
we're doing that. Anybody that's driving a county vehicle, I think.
Mhm.
will say. But I think the point is say you've got a supervisor, if somebody comes to you, if the supervisor doesn't have the option of making a judgment call and saying, hey, I suspect this guy is under the influence. I want him to go now under this wouldn't be able to say, hey, you need to go right now and get your test. I think they need to have that option, even if we don't make it mandatory, unless the supervisor that's reported to says, hey, I suspect there may be a cause here, a drug-related problem, let them have the option to go ahead and send them then. You're trying to save money, which most people are not going to be impaired, so you're trying to save the cost of sending them right there where they may not need to go. If they decide to hold off a day or two, they may not need treatment. That's what you were saying a while ago, I assume.
Well, I'm not really looking at trying to save a cost. It's just that sometimes individuals may experience an injury, a strain, or something like that, and then they say, well, I've reported it in a timely manner, but I don't need to go to the doctor today.
But if that drug or alcohol was a contributing factor to that accident, we need to know it right then versus if someone's out here, a law enforcement officer or is out here directing traffic for 3 or 4 hours and gets sunburned, that's not a contributing factor.
Mm-hmm.
But they may, want to claim that as a workman's comp claim. But if someone goes out here and they have some kind of accident, they trip and fall and they twist their ankle and do something, the contributing factor may be this person may have been under the influence of alcohol.
Mm-hmm.
We need to do something, or they may be a paramedic may be out here. I mean, not saying that they would do this, but they deal with drugs every day. This person could be on drugs,
Mm-hmm.
and they go out here, and the next thing you know, they could be out here messing around and pull up a gurney, and the next thing you know, they're back injury. And it could be a contributing factor. They may be on something.
I'll look at that and see what I can
Right.
do.
For purposes of this, we're just trying to change it from may require to will require.
Right.
So then I take it, you would like us all to also, if we're okay with this language, you would like us to go back and see if there's some more instantaneous way of providing the test then.
I'd like for y'all to review that anyway,
Right.
maybe come back
Okay.
to us.
Because that one, and I understand what you're saying about saving money about drug testing, but that one case may cost the county
Understood.
a fortune, and we want to prevent that one case. So,
Understood.
Okay, but what we're saying now that these 34 recordables, then, that meant they were turned in. So that would be 34 people that will receive a drug test in a matter of up to 7 days. Unless they
That's 34 people who did
They
receive
did.
a drug test.
Okay. Oh, before it said May. So
Well, yeah, but we
that
were-
doesn't
we
mean
were-
that was the same as well.
Yeah, but we want to make sure we change the wording to comply with the Board of
Mhm.
Education and the county's employee handbook. Because that's what they say now.
Well, they say they have the Tennessee Drug-Free Workplace, and that Tennessee Drug-Free
that
Workplace
requires
requires it.
that's the kicker. It
Yes,
requires.
sir. They would-
Right now, we're not doing no random, Marvin.
It's department dependent, I believe some of them are, but that's within the departments. It's not a regular county program that I'm aware of.
But is it consistent with each department?
I'm
The
sorry,
random, I mean, if it's random, is it consistent with each department?
I don't know the answer to that.
How much is a typical drug test?
Depending on where it's given, $38 or so if it's given in one of the clinics, and if it's given at the hospital at an ER, it could be as much as $200.
Oh, wow.
What departments are not doing the random drug testing?
Well, I don't know.
You don't know.
I know that the ones that are safety sensitive, I believe, are the ones that are doing it. And then the ones that are not safety sensitive, it's not a requirement.
Right.
But I don't know how their internal
Okay.
mechanisms for that are.
Who decides that?
Their HR departments.
Good.
The next point is on page 7, number 8, and wanted to clarify that a little bit. Talked about medical treatment not sought within the first 7 calendar days. The first report of injury is filed. That's saying that they had 7 days from the date of the report of injury being filed to seek medical attention. We had some supervisors who under the program can file 2 days after the injury, and then an employee has 7 days from that filing date to go to the doctor. We have other supervisors who actually file the same day of the injury, and then they only have 7 days from the filing, which is the day of the injury. So you can have one situation where 9 days the employee has to go to the doctor, someone else has 7. So this is a point to clarify that and to get them all even is the day of the injury. So an employee has 7 days from the day of the injury to go to the doctor under point 8 there.
So if an employee gets hurt today, he or she doesn't tell he or she's supervisor.
They must tell today under the program. Has to be reported.
Yeah, the employee has within 1 working shift to report to their supervisor, but the supervisor has 2 days to get the paperwork and all that into us. And this was working off their date of report.
What does that do? What does that, if it goes to 7 days, what does that do as far as liability to them?
It gives the employee, a person who gets injured today and his supervisor, today being Monday, his supervisor reports the injury on Wednesday, then it allows that employee to take 7 days from Wednesday, which is to next Tuesday, to go see a doctor. A supervisor who reported the injury today that happened today, then that employee would have till next Sunday to go to the doctor. So there's 2 days difference between the 2 employees. This would allow that to be even for both of them. It's from 7 days from the date of the injury.
It's just in order to clarify the document,
Okay.
And to make it, again,
consistent.
with everybody.
Okay.
On page 8, we had in here that they would seek treatment at the emergency room of the Middle Tennessee Medical Center or the nearest emergency facility. And we want to change that to say that the nearest facility selected by the medical or emergency responder or transporter. And what that is for is so that we're not making the choice. We don't want necessarily a Middle Tennessee Medical Center is not the best place for that individual to go. We want the responder to be able to make that selection where they need to go. For example, if somebody needs to go to Vanderbilt, then they need to take them to Vanderbilt. They just don't need to take them to Middle Tennessee Medical Center if that be the situation.
Because it may be serious enough that someone's going to have to make a decision, let's go there.
Yes, but this says Middle Tennessee, so this just, again, clarifies it and gives them that option and brings us to that. On page 9, at the bottom, the 4th line from the bottom there, it talks about mediation style discussion. That's where, as the safety coordinator, I meet with the injured individual should they be, their claim be denied, and have a discussion. We had put in there a mediation style discussion. We found that what I'm doing is not really a mediation style discussion, it is a discussion, and try to understand what the full impact is of what's going on, do an investigation, should it be something that I've missed in the initial. So we want to take out mediation style and just say it's a discussion. There's no mediation to it. On the page 10, under the appeals panel, the first one you see there in paragraph 2, it talks about the human resource coordinator. And we had just said the human resource coordinator. We actually had wanted that to say of the county's division. For example, if a division has a human resource person, then that is the person we want to have. So if you have the county general or the Board of Education or the Sheriff Department, whoever has a human resource department, they would have a representative in that appeals committee. And before it just said human resource representative, so we clarify that. The last item you see there, that is case law that came out in February of 2009, and it just basically under OJI programs makes sure that an individual has the right to have representation. We didn't outline that in our plan document, even though when the case law came out, we have conformed with that. We didn't say that. We've always allowed any individual that has an appeal to actually come forward and bring anybody that they want to the appeals hearing, but we didn't have it in our documentation, so we wanted to add that. And what we've said is they may be represented by counsel or a designated representative. And we've had people bring their supervisors, family members, whoever they want to be. Nobody has been turned away to this point. And that's, again, just to add it in here to conform to the case law. And that's all the changes that we were looking at. We just wanted to bring it to you for information purposes and present it to you.
Well, with these changes, I guess the changes need to be adopted by the county commission.
Yes.
But they've been through the insurance committee, and the insurance committee is recommending body onto the budget committee. So I guess it goes to the budget committee then for approval to be sent to the county commission. So, but we wanted you guys to know exactly what we were doing.
Well, I mean, that,
On page 9, go back to that for a minute, where you start with mediation style. Now, this meeting that you're talking about, this is not the meeting where you originally report the accident. This is a OJ benefit review, which consists of a meeting between the employee and the safety coordinator or OJI representative.
Yes.
And at that time, you're not doing any mediations, as long as you're trying to strike.
What happens in the first report comes in of injury, the individual's report, the supervisor's reports all come in to my office, and I'll get that, I'll review that. I may have some follow-up discussion with the supervisor and determine that a claim is not going to be accepted, it's going to be denied. Then I send a letter to the employee and let them know that. Once that happens, then the employee has the right to appeal, sit down with me and discuss something, and maybe there's some information that I was not privy to. Maybe something happened or there's some other information that I didn't get that they would be able to present that I might reverse the decision on that.
So that's at this step.
That is at this
Talking about what
step,
you're saying.
and it's
So
not
they're-
mediation style, it's just simply a discussion.
They're basically bringing you information you may or may not have.
Yes, and making sure I share with them all the information and how I reached that
In
decision.
the next step, which by case law, they can have representation.
Yes, sir.
And at that time, you might have mediation.
It's not, that one's not really, I guess mediation isn't quite the right word for that either. I set those meetings up. I'm not a voting member, I'm simply a facilitator. And we've had 3 of them thus far. And that what they do is they bring in any evidence or statements from other people that would lend themselves to a different decision process. And then there's a panel there. They go over the case file, they go over the statements presented by the person who's appealing the claim and by any other representation they have. And then this committee actually discusses the claim and makes the final decision.
when he makes the decision, is it before, is it right after the discussion meeting?
I hold the discussion meeting. The decision is made prior to that, and then I inform them of that, and then they come in and sit down and we have the discussion.
So if employee, say an employee disagrees with your decision,
Yes.
at what point do they get a chance to get their side heard and try to get it overturned?
On the second level appeal.
On the second level appeal, okay.
Yes. But I meet with the individual initially first also, so we have a face-to-face discussion prior to going to that level.
So if you find out different facts,
I can reverse myself.
you can reverse yourself, and it won't get to this level.
Yes, and I have done that too. I have reversed because there's been additional information presented.
Okay.
The last step is like a review board.
Exactly. Mhm.
And they're gonna make a decision one way or the other at the end of it.
Does anybody have any questions on what they presented so far?
I'd just like some more information on this first discussion we had. as
About the
far
drug
as-
testing?
Right. Clarification on what we're gonna do.
Now, and that probably needs to be done before this actually goes further to the county commission.
That's my opinion.
And I know when you were talking about wanting to go through budget, and I know there's 2 members on the budget committee here and may feel different than this, but I think it doesn't have anything to do with monies right now.
Right.
I think this needs to come through the public safety committee, and if we can recommend it on towards the full county commission, would be unless somebody here can correct me or whatever, but
What's the insurance committee have to do then?
Well, the insurance committee, because it's a summary plan document change, they had to review and approve before it could be sent forward. And so they've done that, but, and they recommend, they're recommending body into the budget committee, so that's why we were headed that direction. But again, as you mentioned, it has so much to do with public safety. That's why we wanted to bring it in
Right,
here and have you
right.
guys review it as well.
Well, I don't have any problem with it coming back to public safety, and then they forward it to budget if they want to. And the reason is there's gonna be money involved, whether it's
Right.
overt right now or not,
But
there's
right,
money
but right
involved.
now, there's not. I mean,
No.
at the end result, it's gonna be, but right now, through this process, it's actually, I just don't want this committee, I want us to have the input like we've had tonight, and then if there needs to be some changes, we make some changes.
And follow up on what we've discussed here.
Right.
We can certainly do that. We'll go back and
Okay.
work on the drug testing timeline and
Okay.
see how we can make it a little more efficient.
I'm sorry, I said so much about that. I don't mean to be a bear about it, and I know some of these are very minor injuries. I'm just thinking, in my mind, of you trying to build a case file that 3 or 4 days later that they've had a previous, let's say, back injury and they've taken Soma, but they're not on Soma anymore, and then they have an arm injury, and because of that injury they're hurting, so they go back and they take a couple of their Soma because their arm has been hurting. And your drug test is going to show that. And can we prove they were on that at the time of the accident, or if they took it afterwards? We're going to rely on their word when we really are trying to build our case.
What would end up happening, under the way the drug testing program works, is I do not find out. It goes in, they get tested, it goes, and should it come back, it goes to a medical review officer, the MRO. The MRO then takes that information, contacts the individual, and talks to them about what prescriptions they have and are they valid prescriptions. They confirm that with the pharmacist. And then once he does that, the MRO releases documentation to me with only one of two words, either positive or negative, and that's all I get. I'm not privy to any prescriptions they would have or
You
not.
see what I'm saying? That we'd want to know at the time of that accident, not afterwards. If they were on Soma or not Soma or whatever they may be on that day.
If one of my employees notifies me that they've had an accident and they're hurt, whenever they notify me, they're going to the doctor, right then and there. And then if there's unless it's a contributing factor, they're gonna be drug and alcohol tested, right then. 10 o'clock at night, 10 o'clock in the morning, whatever. It all depends on where they're gonna go. So, I mean, now if they get hurt and they don't notify their supervisor until 3 days later, and once that person is notified,
Well, under the program, that would not be covered as an on-the-job injury because it must be done within that shift.
but as soon as and once they do, everybody knows where to go.
Understood?
Let me ask real quick, why the disparity on the cost of the drug test? You said $38 to $200? Why the fluctuation?
Well, it just is. Things are more expensive at the ER. Plus also, they do not do the testing at the ER. It's contracted out, so somebody has to be called in from the provider. So it may be 2 o'clock in the morning and somebody has to then be called in at 2 o'clock in the morning to do the testing.
Not trying to play devil's advocate here, but your average cost looks like $700 if you take out your strain and I'm assuming back injuries. $700, $575 on punctures, scrapes. Is it really worth spending that much on a drug test if your average claim is $700?
The Tennessee Drug Free program says that if there is a claim, then there's a drug test.
Mhm.
And so,
Well, how do you protect yourself from having a $575 claim and you're going to pay $200 for just a drug test?
well, in that case, you're hoping it's the $36 variety, but
Yeah.
But yeah, you do have that issue. But most of them are, if the smaller claims that happen and they're not something that sends somebody to the emergency room, then they'll go to one of our urgent care type clinics and they'll be drug tested there and that'll be the $36 or $38 variety.
So by law, you can't put a threshold of a dollar amount or an injury on that.
So it just says to be tested.
Okay.
Now, we can obviously continue to shop and see if we can't get that cost down.
Yes, sir. Okay.
The Tennessee Workforce Drug and whatever it's called, it dictates every bit of that.
Does it?
Yeah. So then, in that, you gotta do it, right?
Well, if you have a claim incurred, then you have to have a drug test, and that's somewhat of a problem because, as Dan was mentioning earlier, when you have someone who's simply had a pathogen exposure, that still generates a claim because it's a test that has to be done, and because of that claim, then there's drug tests involved.
Well,
in that.
the flip side is, if I was an employee, on the insurance, and I am full of drugs, I don't want to get hurt. So that there's an incentive there to practice, work safety there.
All right, thank y'all. All right, ambulance service.
Lose your job.
Chairman's representative came in, so if you want to take him.
All right, you were first on the agenda.
Yes, sir, I apologize, I was late.
All right.
Yeah. Thank you, sir.
And again, I do apologize, I was late. I helped by the train in town, so.
All right. Go right ahead.
Okay, as you see, this is our, basically what we've done from last time we was here 3 months ago to now. One extrication, 47 non-extrication calls, 5 medical assist, 1 water rescue, which basically that was Christiana last Thursday? Yeah. 4 false calls, 3 first aid standbys. We've had 15 trainings, which we are doing trainings now every week on Tuesday nights now. 1 event, I'm not sure. I'm pretty sure that event is 4th of July fireworks for Smyrna. Maintenance, we've done I guess 13 items on maintenance. Fundraisers, that was fundraiser last month, and we've had 6 meetings.
On the 47 non-extrications,
Yes, sir.
what is that, just, you roll in on a 46 call and it turns out to be a 45, or just a
Basically.
small?
Or just a small 46 call. No extrication needed, just out there helping the ambulance service.
Okay. Have you had any vehicles during these 3 months that any just out of service, anything?
No, sir. No, sir.
Any questions?
How y'all doing financially?
I mean, it's, typical volunteer service, it's, it's up and down. We are, I have scheduled a whole lot more fundraisers.
Yeah. Are y'all getting that information to IT? I see other ham breakfasts and things, but I don't see.
Oh, yeah, yes, sir. We just, actually, I just started putting stuff on the Channel 19, the county network. I just started that, last month. And, because I didn't know how to get a hold of anybody to do that, and I had to come up here to the courthouse, and I forget who I talked to, but they gave me the information that I need to see about that.
Are y'all doing a picture drive now, aren't you?
Yeah.
How's that going?
It's going pretty well.
Getting a lot of people to help you out?
Commissioner Bartlett's one of them that, this day and time, if somebody gives us $1, we're still happy to get that. And I am going to start sending out thank you letters for people that does donate, whether it's $1 or $100.
So it's going pretty good then?
Yeah. I think it's, I've got about 216 letters to send out right now. So just thank you letters. Thank you for your donation and stuff.
As far as fundraising for y'all, it's going to be your country ham breakfast.
Yes, country ham breakfast. We're having, we had a pancake breakfast last month, but our main fundraisers is country ham breakfast.
Is it about every three months?
Let's see, October, November, January, February, March. And the membership is considering start doing them in April and May too. So it's, we're trying to, basically what we're trying to get our name back up and stuff where it's fell down in the past.
You ought to try to get that information as Smyrna Channel 3, they may.
Actually, I have talked to town manager several times about that, and we're in the process of trying to get that done right now.
Anybody else? I'll entertain a motion then.
Motion to approve the report.
Got a motion, do I have a second?
Second.
And a second. All in favor of the motion, say aye.
Aye.
All opposed? Motion carried. Appreciate
Thank you, Mr. Moore.
it. All right, ambulance service. Thanks, Mike. We're ready whenever you are.
We made 1,830 calls in August. Sorry, 1,630. Average response time was 8.1 minutes, and we had 21 coroner's calls. We billed $997,757 and collected $471,726. That gives us a year-to-date collections of $976,232 and projected yearly collections of $5,857,390. 70% collection rate, insurance write-offs for $325,505. Collection agency write-offs $88,361. And county discount $1,317. I put over in the last column, I believe that's the information that Commissioner Schaefer has asked for. That is the complete totals for the year of 2008, 2009.
That's pretty good, 66%.
Right.
That's,
That's deducting your write-offs down there, right? The insurance.
what I've been understanding is you get 66% collections. That's pretty aggressive.
And what happens to the 34%? If they ever go to collection agencies, you forget about it, or is it
We
just?
send it to the collection agency. In the past, we've taken it to court. And we've never failed to get a judgment in court, but then getting
You
the
get
judgment and
collected.
getting the collection is
Yeah.
Right.
Refresh our memory, what's our rate for a call?
It varies from, depending upon the severity of the call. I think the least amount we have is $375, and it can go up above $1,000.
But with the different categories, we're in line with other counties, the larger Davidson, Sumner, Williamson, and that type of thing.
And we pay close attention to particular Davidson, Metro, Nashville, and Williamson County.
Okay.
The table, we had 18 vacancies for our north end supervisor, and we had Station shut down, Stonecrest was shut down once, and Laverne was shut down once. The thing that creates the vacancies for the north end supervisor is using them to backfill it. Table at the bottom of the page is the mileage.
Mike, I didn't interrupt you, but not just north end supervisor vacancies, you had 18 station managers, Randy, Tommy Brown, any other supervisors yourself. How many more of those are you have to backfill?
If you'll just refer to the last sheet here, On the opposite side of that. This is for the month of August. We had personnel who took Family Medical Leave Act 524.8 hours and vacation hours 51.2. Once they run out of Family Medical Leave Act, then they can take vacation hours. Or sick leave, then they can take vacation hours. Sick hours of 278.5, vacation hours of 1879, and none of those are, we don't have funding for that in our budget. So that's a total of $47,986, almost $48,000.
You don't have vacation hours in your budget?
And
You have vacation budget in your budget, surely.
No.
I mean, you don't take into account that these guys have vacation accrued in their
No,
salary?
the county never has done that. And that was what I spoke to pretty vigorously this year. But that's costs that aren't scheduled in our budget. So,
Their pay is budget, but you're saying coverage for them being out on vacation is not covered, is that correct? Okay, I misunderstood what you were trying to tell me.
and we didn't, of course, we didn't spend that much money. And the reason we didn't spend that much money is because we use those personnel to backfill. Right. The schedule that we use is, we use we're allowed to use 2 PRN people per shift. That's what we're allocated for in the budget. And once we get beyond that, then we'll use our people to backfill.
I mean, I guess the reason I asked, I knew that there was other people doing it, but I know there've been times I've called from Randy and they said he was on the truck. So I knew that was happening, and I thought, well, the committee might want to know that, so.
Yeah, so Tommy Brown in a football game, and we could tell that.
I'm sorry for interrupting you.
That's okay. The unit average, the miles driven and the cost per mile and total operating costs are listed on the table at the bottom of the page. We did have 2 ambulances that we had breakdown in emergency calls. So I think that's probably to be expected because our fleet's aging pretty rapidly. We had an ambulance that was involved in an MVA. It's been several months ago, but the insurance company just got around to totaling that ambulance. I'm not quite sure how we're going to replace that ambulance. I believe we got a little over $40,000 from the insurance company, so we have that much. But
Is that the one over on Rutherford and Mercury? Okay.
When will you get word back on the grant that you've put in for, that we haven't ever gotten before?
It's still pending. We haven't heard back from them. We have a total of 32,099 miles. The total number of calls responded to that were actually out of the individual stations that are listed there, the total was 237 calls. On the second page is our in-services and training. 12 things that are listed there. Federal medics have no budget for training, so they don't get to do very much, except and especially events. The TOPS team had a tactical medicine class for the Rutherford County Sheriff's Office, and then they participated in the FAST team training. REACT and other special event standbys are listed there. A lot of REACT type things. We provided medical coverage for all the high school football games, and also for National Night Out and soccer tournaments and MTSU graduation.
Yes, well, let's just say sporting events. I don't know how all of the rescue squads work, but do you coordinate anything with the 3 rescue squads if they're going to have a full staff, say at a event some night? Does that mean you don't need them there, or there's really no coordination?
Some of the rescue squads are staffed by EMTs and I guess occasionally paramedics. Is that right, Randy? But typically they're not, so. And we charge for those events.
Mhm.
So, and I have some money to transfer here in a minute.
Okay.
And the sort team things are listed there. I think I sent you all a copy of that report.
Is anybody not getting that report every month? So they can go to
I
everybody.
can put Commissioner Sparks on there. I'll put that on.
Okay, appreciate it.
Next page is the response time report by stations. Our transport team made 47 critical transfers. They also answered 66 911 calls. The total for that 1,630 calls. Next page breaks those calls down into commissioner districts. Breaks the transport team calls down. Primarily that's Middle Tennessee Medical Center and Stonecrest Medical Center. Also the VA. We always have a few each month for the VA. Next page is year-to-date on the same information. And we have several thank you type notes.
I'm glad to see two of my constituents on here receiving an award. Husband and wife team.
They are a husband and wife team, but they don't work on the same team. at
Yeah,
times.
yeah, they're on different shifts.
They're on different shifts, yeah.
Any more questions for Mike? Or any more questions, any questions for Mike?
Mike, on the breakdowns, on the two ambulance breakdowns, what was the problems with those?
If I remember right, one of them was a turbocharger problem.
Yeah.
And the other one was, there was also a fuel problem. I don't remember exactly what that was, but it was giving too much gas or something.
Yeah, so they both, what was the typical mileage on those units?
I don't know exactly. I could look back there and tell you. One of them happened on 41. The mileage on that is 154,278. The other one happened on 59, and the mileage on that one was 27,924.
Okay.
How many miles we gonna run those up to?
About 175 is when we really like to get rid of them, but we've got a lot of ambulances approach at 175.
Now, there's a new law, I think, if it's already hit or going to hit, it's already hit. Once an ambulance makes a certain point of mileage, was it 150,000?
150,000 has to have the certified mechanic.
Yeah, every year. So it makes it harder to keep those things a little longer than we have been sometimes. But that law went on the books this last legislative session. Any more questions? If there's not, entertain a motion.
Motion to approve the report.
Second.
Motion and a second. Any discussion?
The ambulance station shutdowns, the two that we did there. How do you figure or point out like the station two shut down?
We shut down the station that we're unable to staff.
Because of those people that are out at that station.
So if you have a paramedic calling sick and the other one, EMT or paramedic, is on the partner comes in, you move that person to another station to fill in somewhere else, and it's like filling vacation or whatever, and shut that station down.
If we have one person to call in, and the support team moves over and takes over that station, and then we send the person that was left at that station is the one that then travels to wherever we need them.
So if the partner calls in sick quite a bit, the other partner
Get some
will be
upset
saying, hey, come here.
Peer pressure is a wonderful thing.
It does.
Something people need to understand is that doesn't, just because the station shut down, doesn't mean that people don't respond. They still
Right.
respond, they're coming out of another station, which means the response time may be higher.
Right.
So, that's where we're running to the problem, but just doing some numbers here, 1,630 calls with 12 stations, that averages 4.5 calls per 24-hour periods per station. So basically, if one of the stations cut down on average, the other 11 stations would share in approximately 5 calls.
Right.
Your heaviest station was Burton, and they averaged about 7.5 calls per 24 hours. So if you shut that one down, you'd be dispersing that between 11 stations.
Right.
So we're still getting a response there, which is,
They have the shortest response time though, don't they?
right, they would be in their
Because
area.
they're the closest. Mhm.
And the average, you said, what, 8.1, 8.2 is this
8.1, I
month?
believe,
So we're
8.1.
kind of holding our own there, at 8.1.
As long as we're still running an 8-minute response time, that's
That's what we're at, yeah.
that's what time we're after, right?
I'd like to see it about 6, but
Well, yeah.
I don't think you'll ever see that again with the population growing. Yeah.
Well, I think in the Smyrna and Murfreesboro, the response times are probably 4 or 5 minutes, but if you outline areas that actually cause that response time to go up a little higher, is that correct?
right, consistently, the Burton Street station has the lowest response time. And ordinarily, it's Salem Road or MTSU station that has the second lowest. It's more of a function of the size of the zone than anything else.
Anybody else?
Is the sort truck, is it ever shut down to accommodate these ambulances, you know?
The sort team is a different kind of a animal. They have made a vow they will not shut that truck down, regardless of what it takes. Do we have absences on the sort team? Yes. But we also have members of the sort team that refuse to shut that truck down.
How much is an ambulance?
How much?
Yeah. Replacement.
How much does it cost? Is that what you're asking?
Yeah.
I believe that the last time we bid it out was about $127,000.
And we're gonna probably need 9. It's coming in.
I think there's a chance of getting 9. The mayor and I had this conversation not long ago, and he said that pretty much what we've been doing, he could see the logic behind it, where we were posting 2 per year. As long as we maintain that schedule, things seem to work out okay, but we haven't maintained that schedule the past 2 years. We did get 1 ambulance last year on a grant,
Right.
and that helped us out.
I said, y'all applied for a grant for 2 this year, was that correct? And hadn't heard anything back on it yet? Anybody else? We don't have a motion on the floor, do we? Do? Okay. All right, we got a motion and a second on the floor. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries. You got something else on you?
I have a budget transfer. This is all money that has been brought in from special events. We received checks from Middle Tennessee State University for $54.95, Rutherford County Schools for $33.80, and Rutherford Soccer Inc. for $2,015. And we'd like to put that back into the accounts for the money we spent.
Okay.
So moved.
Got a motion, do I have a second?
Second.
Have a second. All right, discussion on the motion. That's roughly $10,800 something, right? All right, call roll.
Commissioner Black?
Yes.
Commissioner Daniel?
Yes.
Commissioner Hall?
Yes.
Commissioner P?
Yes.
Commissioner Schaefer?
Yes.
Commissioner Sparks?
Yes.
Commissioner Farley?
Yes. Anything else?
I asked Randy to come and give you a report on the flood situation.
Okay.
What I prepared for you is the press releases that the Emergency Management Agency had me send out to all of the news media, and I know that I send some to Commissioner Farley also. And this is just exactly what happened in there. And basically, I remember one of the commissioners said a picture is worth 1,000 words, and so I've also got some pictures in here. This is an area, the flood area, that we covered. We had several different incident commands going on. We have one primary incident command where Emergency Management Agency and EMS were involved together, taking care of making sure that we evacuated houses, checked houses that were flooded, things like that. But you can see it was pretty widespread right across that area. The National Weather Service is now saying we had about 8.5 inches of rain in less than a 24-hour period in that area, and that's why we had that 100-year floodplain kind of broken then. It also, on the first page, has all the different agencies that were involved in that. We actually called in the Murfreesboro Fire Department and their Swiftwater teams to give us a hand. I want to tell you that that by far and away, we work so good together with all the departments, and mainly because we're multi-jurisdictional. The EMA is multi-jurisdictional, and we have a good working relationship and a good training relationship with all the departments. And every time that we're called, it just amazes me that people answer that call. You know, when people are running away from the flood, we're running to it. And when people are running away from the tornado and the winds, we're running into it. And our guys are just some of the best, I think, in the entire state on rescue and rescue techniques, especially in swift water like we had in this particular flood. You have to understand that national statistics say that we lose one rescuer for every one that we save. And so, you know, in those kind of events, you know, they're putting their lives, you know, in peril. And they do such a good job at that. There's also an editorial from the Daily News Journal that I put in there. I think it says more than I could ever say. We had some heroic things going on that day by all agencies. Emergency Management Agency, they had people outside taking care of business, and EMS and fire departments and the volunteers, and it was just a massive response to get those people taken care of. The Red Cross set up a shelter. And then the last 4 pages, I think, are the pictures of the flood. What I came to say was, you know, time and time again, and I want to direct your attention to the last picture on the last page. I just want to tell you that time and time again, we answer the call. The rescuers answer the call. That picture was taken last year at this time. So it's not just 1 year that this happens. It continues year after year after year. You know, we talk about cutting training, we talk about cutting resources and things, but every time we need more ambulances, a station manager is there, or an extra SORT member is there. We had 11 people on the SORT team involved in this, and, you know, we only have 2 working in a 24-hour period. So everybody came in. We had 2 station managers on that day on ambulances, and their houses were getting flooded. And so we, you know, I think that Rutherford County ought to be proud of what we have, and these guys are doing a great job out there, and I think that they need to be commended on what they do. EMA, EMS, fire departments, Murfreesboro Fire, Sheriff's Department, they were just, you know, they made sure that people were safe, and that's what public service is all about, and that's the function of government.
And I'll echo everything you just said, Randy. You know, that night we had a county commission meeting, and the last night I stood up and, you know, acknowledged about what those people out there were going through, and the community out there, as far as the citizens, what they were actually having to go through. Some of them wasn't even going to get sleep in their bed that night, where a lot of us were. You know, I've said it before and I'll say it again. Rutherford County is second to none in the state of Tennessee, even in the southeastern, in my opinion, United States, when it comes to people in public safety, when it comes to people in community citizens, when it comes to people in county government and city government, from the town government to Smyrna, Laverne, to all the way to Murfreesboro and Rutherford County, because you're right, the Sheriff's Department, the volunteer fire departments, the rescue squads, the ambulance service, EMA, and I know I'm probably gonna leave somebody out there, I apologize if I do, but all across the board, they stepped up, they done the job. I went out there that day, just to, come out and not to do nothing, but, just a moral support. And, those guys they were out there doing everything they could to help those people out there. And it is, when people in this community, when there's a disaster, people come out and they take care of business. We're not like other places. We don't sit around and wait for somebody else to come take care of us. We take care of business, and we take care of our people. And that's the way it should be.
I agree. Yes, sir.
Got a question for you. On this first page here, you know that the 911 district activated the emergency telephone notifications.
Yes, sir.
I want to point that out so people hear this, that y'all contacted 1,700 residences.
Yes, sir.
That were in that immediate area in danger, and they were notified, but we only had 141 calls confirmed that called back. And I assume these guys didn't take time to call you and they got out, or they weren't at home.
Yes,
one of the two.
Yes, sir.
The other thing I wanted to ask you, in case of a tornado, that we see an imminent tornado, or is this same calling dispatch was that activated during this recent storm we had earlier this year?
It was not, as far as I know, or at least I haven't been notified that it was activated. But as far as I know, no. As far as the possibility to it be activated, then the answer, of course, is yes. It can be activated, and we can also put it in a particular region. That's the region that we need to watch out for. That storm came up very quickly.
It was on holiday.
39. It was a holiday, and 39 minutes, on the ground from 22 and a half miles, 750.
Well, that's kind of what I was getting at, within, 30-something minutes there, looks like we could have got that activated if we didn't, but what I want to do is please look at that and see what we can do to enhance that, because that's really something handy. I mean, I sleep at home and that telephone's ringing, I may not like it, but that could save your life in a case like this. And I've had complaints about, hey, we don't have a siren system out in the county areas. If this is a way that we can contact people
Actually,
at home like that.
Our dispatchers are going through that training right now.
I was gonna say, I'm on the 911 board, and that's been recognized for SVP, and they're having training courses so that it could be implemented from the various public safety answering points.
Well, I think that's going to be a good asset to this area. I appreciate you putting that in there.
And I'm glad you brought that up too, because matter of fact, that night at the county commission meeting, there was a lady that was in the audience that night. And she actually spoke up and said that her daughter was out in that area and got a phone call, and it helped her be able to prepare. She spoke very highly, and I don't know who the lady was, but she did speak very highly of that, and it is a good program.
Randy, real quick on some of that flooding, someone had told me that I think something that helped cause it was I think a large tree or something, or a lot of debris had piled up in one of the creeks.
I don't think we've done any investigation on that. When Roger comes up, you might want to ask him, but as far as I know.
'Cause it hit the 500-year mark, right?
It hit the 100-year floodplain.
I'd heard it hit the 500-year.
And that very well could be. I haven't read that anywhere, but I know that it did hit the 100-year.
Okay.
It did, it scared it to death.
It scared it.
It's a wide range,
Anybody else have any questions on that?
That's just what I
You got some more you want to
I
ask?
heard it was a creek.
Okay.
And it blocked it.
If nobody has any more questions, we'll go ahead and move on then. Thank you. Thank you.
Thank you.
Correctional Work Center.
You had to help Tracy out, that dog there.
Yeah, close. You watch what kind of dog you have for a pet.
All right, I'm going to be very brief like some other people. I'll wait till everybody gets a copy. Page 1 of my report reflects the inmate work crews and hours that they accumulate on the different job locations and the dollar value we assign those hours and the saving totals that we give for those community work services. Next page on the report is the state bidder for the month of August. We always run a little bit behind on that. So we collected or billed to the state roughly $4,500. Following page are your county roads, litter removal. We removed 15.6 tons and covered about 112 miles during that month of August. The following page is the monies that we bill or have collected from the different courts for the per diem fees that we assess to the inmates during their stay. And then the last 2 pages, I believe, are minutes of the September 3rd board meeting 2009.
Just for people out in the watching TV, actually, for the month of August, those inmates working out with different municipalities or the county or whatever, roughly could save $232,000 of taxpayer dollars.
Money not being spent, yes.
Right. Anybody have any questions?
Move to approve.
Have a motion, have a second.
Second.
And a second. All in favor of the motion, say aye.
Aye.
All opposed, motion carries. Anything else? Appreciate it.
Real quick, out in Lamar Road, is the Corps being pretty good about picking up some of that trash and all?
There was a communication problem, and we didn't find out for some time that they had swapped basically cellular services, and we were leaving messages and stuff. So there was a few weeks that they got behind. We were ahead of them, and some of it did accumulate. But we finally resolved that, and I think they're now, we're picking it up faster than they can collect it yet.
Are you seeing people go back there and illegally dump again?
Unfortunately, yes. In a lot of the areas we clean, we just have to put them on a regular cycle now. We'll go
There's
back.
signs posted out there, isn't it?
Yeah, the area is relatively posted. I think it's just, it's recreational use areas that we're cleaning, and people are just careless about how they dispose of the litter.
Yeah. All right, thanks.
All right. Appreciate it.
Thank you.
Sheriff's Department report. How you doing?
This one. Okay, our first budget amendment is to transfer $45 into our 54210-499 other supply account. This is where we had our grant for the community enhancement. This is money that we did not spend, so we need to go ahead and pay that back. This is the $45. And the second budget amendment is to recognize the JAG recovery money, $538,165. And if you recall previously, we talked about this. This was the multi-jurisdictional grant with all the agencies.
This is the one that you all, the Sheriff's Department did all the paperwork stuff on this one.
Yes.
Yes.
This is where we get the 5% administrative.
Yeah, it's split between City of Murfreesboro and Rutherford County. Anybody got any questions on it?
And the bonus one.
And okay.
Motion to approve the transfer.
Second.
Motion and a second. Any discussion? All in?
Commissioner Black?
Yes.
Commissioner Daniel?
Yes.
Commissioner Hall?
Yes.
Commissioner P?
Yes.
Commissioner Schaefer?
Yes.
Commissioner Sparks?
Yes.
Commissioner Farley?
Yes.
The second attachment is explaining about the grant. And then the only other thing we have is the budget report.
Okay. So this here just explains what we discussed, we talking about. Okay. All right, anybody want to look over the budget report, and if there's no questions, I'll entertain a motion when you get through.
Motion to approve.
Got a motion, do I have a second?
Second.
And a second. Discussion? Hearing none, all in favor of the motion say aye.
Aye.
All opposed, motion carries.
And at the last public safety meeting, you requested Dr. Roger Robertson.
Chief, now, one question before we get off this point. We, y'all put in for that, another grant that was dealing with deputies. Has there been any word on that yet? Because I thought we'd heard that it was gonna be in September around is when
Oh, no, that grant so far has been denied,
it had.
yes.
Cops grant it was tonight.
Okay.
I don't remember who it was. It may have been Commissioner Johnson last month. Had asked about Dr. Rudd coming up. And
Yeah,
just
it was.
explained. So, welcome.
Hello, good to be back with you again. It's hard to believe, but December 1st will be 4 years since we took over the medical. Mr. Ken Tucker is nurse manager, works with me at the Sheriff's Department, and 4 years has gone by quickly. It's going well. We are, I believe, taking excellent care of the inmates, and we have instituted a broad range of healthcare measures for the, both on-site and what we refer to as off-site healthcare. We have obtained substantial discounts in our off-site care. We are staying within budget. We have instituted a very comprehensive risk management program. We have had lawsuits. We have not lost any. It's hard not to have some with the way federal law allows inmates to access the the judicial system for healthcare issues, and so we're going to have those, but we're very complete in the way we document. We're very careful in the way we provide care. We have people there 24/7. We do all our own medications. We do the formulary that basically I designed the formulary that we use in a way to provide access to all medicines and still have discounts on our costs. I feel like we're doing a good job for the county, and right now, knock on wood, I hate to say it's under control, but it seems to be.
How many instances have, I know you work well with the judges whenever there's an inmate that has a serious illness or whatever, maybe we can get them moved out of our system where the taxpayers don't have to pay. How many times over the last 4 years have you been able to take care of that?
50.
And roughly, how much money have you saved the taxpayers?
It would be
by
a
being able to do that?
guess. I'd like to say I know exactly, but because when you get somebody out, you don't really know how much they would have cost. Because basically we could have somebody there who seems pretty calm, but then they, start having chest pain. They're transported. They ended up with bypass surgery. I mean, it can go up so fast.
But you normally don't do that unless it's some kind of serious symptoms or anything
Right.
like that. So.
Right, and we've, we're very careful about what we do, and we try, to work from the beginning of the booking process all the way through to pay attention to what's going on with an inmate. When they're arrested, we have a triage system that's in place, and we're beefing that up now to even do a better job at it so that we can, be on top of what's going on with the person from the time they enter the door all the way through. We're particularly attentive to women that are pregnant to make sure we meet their needs and still protect the county on that, to try to limit our costs on that. We're dealing with a tremendous amount of alcohol and drug abuse. We deal with a tremendous amount of psychiatric illness. Psychiatric medications are one of the things that, is a big expense. And, in doing the things that we've done, implementing our formulary, being attentive to, to watch people, close monitoring, we've cut our psychiatric drug use dramatically. We're below the national average in Rutherford County now. And in fact, one of the things that I'm doing is we're working hard to become an accredited medical clinic, which there is not one in the state of Tennessee in a county jail. And, hopefully within, one of the things that's difficult to do is you have to be able to meet all the criteria for accreditation for 2 years prior to applying. So basically, we're in that process now, working toward accreditation. So I hope that, we'll be able to come back here and say in a couple of years that we're there, which would mean that we'd be the first county to have that. And, but I feel like overall, we're doing really well. I'm very pleased. I think we've got a great team of people, it's a lot of work.
Well, I think this program was implemented, basically, it's got a cost savings to the taxpayer, because healthcare, inmates are not the healthiest citizens that we got.
We can vouch for that.
And also too, the liability on the county.
And basically, I take the liability away from the county, and in doing that, I'm very attentive to what we do and how we do it. And, I work closely with my malpractice carrier to, and designing everything we do. And we have had lawsuits because, there are lawsuits that would not have appeared in the private sector. When a person is incarcerated, there's a whole special set of rules that go into effect that allow them access to the judicial system, to the court system, in a different way than someone who's not incarcerated. And I think it's just to protect them. It's federal law. And in doing that, we might be defending something that would never appear in a private situation. And, in fact, that's what happens. We still have to do it. It still costs money. But fortunately, we've not lost anything.
Right. Okay. Anybody have any questions for Dr. Rudd?
Well, this might be for Bob or maybe Regina. What line items does Dr. Rudd's services fall under?
Is it contract?
What line item on this?
399, 5422, 399.
54 what?
2210, 399.
Okay. And that's all the employees that he has, like Mr. Tucker.
Right.
Yeah.
And, well, it's not only employees, it's medications.
Services.
It's everything, yeah.
So it's all conclusive under that, inclusive under that one line item.
And, one of the things that, it's hard to imagine the extent of the healthcare needs there, but, in an average month, we will dispense about 35,000 doses of medicine. That's in 2 med passes a day. That's how much we will give to the inmates. And
How much again?
About 35,000 doses in a month.
No, month.
In 1 month.
Golly. So you're talking roughly an average of, in the neighborhood of 4 a day, roughly.
Well, if you could average it out
Yeah.
like that. There are some that are on nothing, fortunately.
And just think of that much 35,000 a month. Just think if we were doing it ourselves and relying on the deputies out there to have to do that, what liability we would have.
Well, the errors.
As far as errors and stuff like that, it would.
And we are, constantly monitoring how we do that. We're looking at our error rate. We're very low on it. We have a computerized system that helps us.
Mm-hmm.
We have a training program that we've implemented and have, we do constant retraining. It's a whole system that we've developed, and I think it's doing a good job. We're doing it, I think, overall very well.
I know in years past, before we implemented this, I know just about every other month we were up here, or they were up here asking to put more money in the line item for medical purposes, because it was growing. And it was a moving target, and I think that target's not moving as much as it used to be anymore, so.
Well, you don't hear it from the media as much as we used to, because you could count on about every other month we was hearing things.
Yeah.
So,
Fortunately, we had that one inmate that did pass away immediately after leaving jail when he was transported to the hospital, and when the post came back on that, it explained it, and it was just an individual health issue that didn't reflect on anybody else. So that's the closest we've come to being in the paper, thank goodness. But I think that overall, even that, when we have an incident that comes up, that we always go back and review it. We, are conscientious in how we deal with things like that.
If I'm not mistaken, a lot of times these inmates lose their insurance normally when they're incarcerated.
100% of the time.
100% of the time.
That's pretty normal.
Yeah.
And then we also had some help from the federal government. We used to, any veterans that were incarcerated, we always afford to transfer them over to the area hospital.
And those days are gone.
And those days are gone. They stopped that. So we kind of got our arm twisted behind our back. And of course, this is, where we're coming from. And that's why I was asking about this line item, to go back to that again. Under other contracted services, is that all his is under there? I understand that, but are there other contracted services in that same, or is that just him?
That's just him, on-site and off-site.
Can you look back over a couple of years and give us some data on what we were spending prior to what he was spending? That way, we can see. And it came back that we were actually higher. It really doesn't mean anything until you look at cases, because some years we may have had 3 guys out there had open heart surgery or cancer diagnosis. And we don't know when we set this budget what we're going to have incarcerated and what kind of problems we're going to have.
One of the biggest benefits that we have out of this is the liability factor.
Exactly.
Is we don't have that liability anymore. He's got his own malpractice personal carriers and everything. So the county's exempt from that, which is a huge liability.
Right.
So.
Yeah, don't mistake me. I'm all in favor of this program.
And plus, the number of people who've been incarcerated out there has grown. The population has grown the last 4 years as well, plus prior to that. So.
Yeah, we are also, I think at one time, Mr. Miller's division was also had some different views. Is that correct? Is that still going on?
No, not yet, no. We're not doing anything with the workhouse.
Okay.
What's your average inmate population out there right now?
We're around about 730, 740 right now.
And it fluctuates up to, 900.
Yeah, we're down. I mean, we're down right now because we've been filling the workhouse up.
You're saying it's 35,000 doses
per month.
a month? Wow.
I know, and we do everything. I mean, basically, we've made a lot of changes in 4 years since we started. Basically, we are able to buy drugs in bulk. We package them, we process them, and get them to the inmates. And all of that is done in-house. And, it takes people to do that and train people. And, and it's a lot of work. I mean, it's basically, there are people who are working around the clock, basically, either passing medicines or preparing to pass medicines. Nurses, nurse practitioners, dentists, plus all the people that we have to use that are providers off-site that we contract with, that we're able to have very good discounts with, that, to help control our costs. So, it's
Another thing that's difficult for them to do is our population fluctuates so much, it's a constant revolving door. We book in probably 30 to 40 people a day that we take into the jail. And hopefully that many is getting out too. So, I mean, you've got every day you're coming in with another 30 people. They've got to do physicals on and do backgrounds and contact doctors and see what medicines they're on. So, I mean, it's a lot of work to do on that, with that population turnover that we have.
But the computer system that we added, at the beginning of this it's paid for itself many times over, because it allows us to have ready access. Since there is so much of this revolving door stuff going on, we can have somebody who comes back in that we know right then. We know what kind of problems they had, we know what to watch for, we know what medicines to get them on, if they're diabetic, if they have seizure disorder, if they're, before they've had, withdrawal reactions to certain drugs. We have a lot of them, and we have a lot of capabilities to do on site. We can do testing in the jail that will tell us if somebody, beyond an EKG, blood test that will tell us if somebody's having a heart attack, if somebody's had a pulmonary embolus, if somebody we have a lot of things that we've added to allow improved diagnosis and decrease in our transport to the emergency room to control our costs.
That's one of the things that we depend on a lot in our end is they get this information so much quicker now than what we used to, and they can identify problem inmates and stuff that's going to be, you know, a liability for us to have in there. If somebody's just too sick to be in jail, it's going to cost a lot of money. And get with us and we start working on that. See if there's alternatives to incarceration.
Yeah,
on
it
that.
could be somebody
A couple of
violates-
people's been on electronic monitoring and stuff, and we've done that. So
Violation of probation, if
Yeah.
you're shoplifting or something, and they have a heart
Yeah.
problem.
Well, the other one that we see pretty commonly is somebody decides to turn themselves in. But they turn themselves in right when they really should be going to the ER.
Yeah, 'cause they need some
You know,
medical
yeah.
attention.
And so, but they've decided to turn themselves in today. And so we always check that, you know.
You do see that?
Oh, yes, we do. You know,
They're not
they'll come
ready
up
to
and say,
die.
you know, well, we decided we needed to turn ourselves in, but in
That's
truth,
crazy.
they're very sick.
Yeah.
And that's why something comes over them, you know.
So they just volunteer to go to jail?
Yeah. Well, they have a warrant out for
Volunteer for
them.
women,
Yeah,
so-
they know there's a warrant out.
Wow.
But it's when they're really sick.
Okay.
Beats death.
Out of those who are there right now,
Let's see.
what percentage of them are likely to be there through the flu season?
Probably most. And, you know, and we have, like last year, what we did, we actually vaccinated about, was it 200? 175. We identify people that are at high risk. And whether they have diabetes, COPD, congestive heart failure, HIV, or other things, and we vaccinate those people. And then we try to isolate people when we can, if they're younger and healthy, and they come down with fever. Fever is the number one thing to look for, you know, in looking at this. You know, and we've developed and applied for the H1N1 vaccine, so that we can, you know, I don't know how much of that we're going to actually get because the federal government through the state decides where it goes. But we have asked for enough to vaccinate everybody, but I don't know how much we'll really get. But we are working, we do have a plan that we have worked on for that, in that eventuality.
Do you have any cases right now?
We've had a few that we've suspected. The actual specific test for H1N1 is about $300. Now they're saying that statistically in the state of Tennessee that if you have flu at this time, it's about a 95% chance it's H1N1. You know, H1N1 is scarier than it is, the perception is scarier than the reality of it. You know, H1N1 is actually probably a milder flu than seasonal flu. And, you know, but there will be people who die from it. You know, there always are deaths from flu, and there will be from H1N1 and seasonal flu. But we treat people symptomatically, and we try to be careful and isolate those people.
Doctor, aren't you, is it something about if you're 30 to 40 something, you're at more risk for that?
Well, the risk is low though. I mean, you know, it's one of those things that, you know, I know that a lot of this is generated by the media. There's this fear of it, but most people don't have a fear every year of regular flu. And that's really a worse illness than this H1N1. But, you know, I think it's the media hype. And when the media uses words like pandemic, people think pandemic means
bubonic plague.
Death, you know. And all pandemic means is that it's everywhere. But, you know, there's a lot of things pandemic that aren't dangerous.
Well, is this not something from a strain of flu that I'd heard that some strain of flu that was around years ago, then if you had that, you're more susceptible to having that H1N1?
It always mutates. Flu is it's a virus that is in constant mutation, And this one hasn't been around before, this, in a long, long time, H1N1. The swine flu in 1976 was what's called H3N5. It was a different virus. But for some reason, people who got the swine flu vaccine in 1976 have increased antibodies to H1N1, this year's swine flu. You know, but in the general public, I was listening to a podcast the other day talking about this, and about 12% of adults have some antibodies to H1N1. They're saying almost no children do, which is what you'd expect. But right now, you know, I think that, you know, the thing to do is follow the CDC recommendations, and when we get the vaccine, for people to take it. But it looks like one shot's going to do it, instead of the original projection was 2. And so now I think it's just 1. And I think that, you know, what we're going to try to do with our inmates is to cover the sickest people with the vaccination, you know, and if we get enough to give everybody, we'll give everybody.
Is there any more questions concerning Dr. Rudd and what he's been doing out there at the?
One quick,
Yes, sir.
going back to the line item one more time. Maybe this will be the last time.
Okay, that's fine.
We've got 0.17% remaining. When we pay that out at the first of the year, his contract is that much. Okay.
Anybody else?
Doctor, real quick, do you stay in touch with other counties and find out what they're doing to keep their costs down?
All the time.
Do you?
Yeah, and I think, you know, actually, I've had more counties call me than you would think. I mean,
Okay.
yeah, because I think we're doing a great job.
Yes, sir.
And I think one of the things that there's a state jail inspector that comes around through all the counties, and I think they had actually said a few good things about us to other counties, and I've had people call me because I believe we're doing a real, you know,
And you're saying you can buy meds in bulk?
Right.
You're saying? Okay.
you know, it's one of those things, the thing that allows me to do that is I'm a physician.
Yes, sir.
And so as a physician, I can prescribe and dispense medications legally. And that allows me to do this whole thing, to help the county. If I was not an MD, I couldn't do that.
Now, I wonder if we're doing the same thing with the county in-house clinics. I wonder if are
No.
they buying in bulk like that?
No.
Okay. I mean, I know it's a different
Yeah,
scenario.
it is, and
Yes,
they
sir.
can't do that.
Okay.
All right. Anybody else? Appreciate y'all coming, giving us information. Also want to commend the sheriff's department on the 9/11.
Yeah.
That was very nice, and what I'm understanding is I don't think any tax dollars went to fund that.
No,
It's
it was
all-
a very good turnout. The community really showed up for that event.
Is that the largest turnout you've had?
Yeah, biggest one. I don't even know if we'll be able to have it on our grounds next year. It's getting awful big.
Yeah.
Good event.
I thought it was very well managed.
Oh, thank you. Well, that's James Harrell and Jimmy Cassidy are the ones that work hard doing all that, putting it together. So we'll pass that
job.
along to them.
All right, emergency management agency. I think it reports on the desk too.
Before I get started on this, I'd like to add a little bit to on what EMS, Mike and Randy White presented. Chris Clark was the incident commander on that, who was the supervisor over the SORT team, and he did an excellent job. And we didn't take it over from him. We supported him and kept him going with what in the direction he was going in. And it just goes that teamwork from the departments is there and functioning, and our office works in support of the SORT team on a day-to-day basis. I had asked Randy, well not Randy, but Mike Nunley, if I could use Randy White as our PIO instead of creating a new one. And he has done an excellent job for us as well. And so we saved by not trying to have another person do the same job. As you look through the report, on the 29th, you see we had an ammonia leak at Pillsbury, General Mills. Butler Drive, it wasn't a major leak, there was an in-house leak. Then on 901, you had a plane crash at Smyrna Air Base. And one of the unique things about that
Close to
is
the house. Yeah.
I'm part of the planning committee for the Smyrna Airport in a exercise. And that's exactly what we're working on, the same location. So it was ironic that this plane crashed in that same area. The other things within the report, we have a quite long one, it's 2 pages this time. Nothing really out of the ordinary in there.
I got a question on 911 there, you talked about illegal burning. I got an email today from a citizen, matter of fact, it was out in your district.
Yeah, but I thought we probably more or less need to carry it before public works on it.
Well,
I mean, with codes.
Well, somehow we got illegal burning in Rutherford County. There's not really a county ordinance on.
Not a county, but there's a state, and there's a listing of type products, anything hydrocarbon based, plastics, things like that, you can't burn. And that's enforceable. We report it to the state, air quality control, and that can be enforced by the law enforcement local. It can be enforced by the air quality control. They come down and
but my problem is with this neighbor, or this situation that we may have right now. Instead of waiting for somebody to come down here from EPA and air control or whatever, it's not as bad out here on a farm or whatever. I'm not talking about a farm. I'm talking about in a subdivision. That you got people that's burning illegally and causing a nuisance to neighbors.
I think one of the biggest problems we're having is that with the growth, you have a subdivision that's already been established, and then they'll come in and cut roads in the back of that, and they start clearing and they start burning brush. And people who have been living there for 4 or 5 years, the ash carries over, covers their car. Because I've had people call me very upset because their cars are covered in ash because the contractor's out there burning brush and clearing. And so that causes a problem in subdivisions that are already established, and they're trying to add on to them. That's one of the things I've run into.
And there's a difference of illegal burn and burning things that are illegal to burn. And like Larry said, the ash and all, when you have in a residential area, that's a major problem. And people should be cognizant of their neighbors. However,
is there a plan for such?
There is not any restrictions that I'm aware of in burning other than the state restrictions of when you need a permit and when you don't. And then of what you can burn and what you can't.
Is there a need for such?
As this county grows, I believe there is. And that would be something that would really need to look at in depth and with the state and seeing what kind of restrictions we can impose.
We had an incident in off 96 Highway in the Broward subdivision. A gentleman who lives up there likes to gather leaves and burn them. Well, he started a fire, and the fire went up the hill and caught a gentleman's house on fire. It had vinyl siding. It melted the vinyl siding off 3 sides of the house and almost burned a carport down. And SO, they thought I could cite them, and I couldn't, so we got SO that called them back out there, and they wrote a citation. But basically because he was burning foliage and it was in a wooded area, it was on a hillside and it went up the hill and it just melted the vinyl siding completely off the house. And luckily the fire department's got there and I was there with them helping them fight the fire. Kipped on Las Casas and Walt Hill, I think, put the fire out. But it actually, I think the guy, I was telling the guy that, they were responsible. He said, yeah, I know I'm a lawyer. I said, well, you know what to do then. but it caused severe damage to the man's house because he was recklessly burning, set it on fire, and it went in the house.
If y'all would, I'd like to see something, you know, some kind of plan come up with, looking at this and seeing some mechanism that could be covered. You know, there's no sense in having a deputy go out there and cite somebody if it gets that far. Some kind of ordinance or whatever, look at it, see what we can come up with.
Shouldn't that go through Public Works, though, Gary? I mean, and then more their line.
On burning?
Codes.
On codes, we can get some information as far as on what the state laws are on burning and what can be burnt, et cetera. But as far as ordinances for here, we have to go through Public Works. It would.
Something's got something to do with public safety. You gotta go through Public Works.
Well,
When
it's
you're
under
melting
codes.
the siding off.
It's
like
under a
a
codes
house.
enforcement. It's a codes thing. You'd be setting up an ordinance of codes for burning, so yes, it would fall under that.
Whatever we gotta do though.
But we can do some background information for that.
I want to go through
Okay.
steering with the legislative body.
Say Public Works was for the codes department, that's why I'm saying that. I know we have in the past.
Okay. Whatever we need to do.
I was gonna talk to Chairman Journey about it. So, Robert, you still on there?
I'm not.
I'm on.
Right.
Okay.
Y'all meet tomorrow night?
No. When y'all discuss it, just to give you some input, I prefer y'all keep that in the major subdivisions. And
Oh, yeah.
that's for farmland.
Farmland's different. It's kind of like the weeds and grass
Right.
ordinance.
As we're going down that
That's-
path, you know, we're talking about preventing farmers going out.
Right.
Exactly, and I didn't want to get carried away like that either. I agree.
Oh, yeah, subdivision.
Subdivision.
And we're talking major subdivision, that's.
Right.
So, okay.
We get quite a few calls when people start burning in subdivision where people are complaining about the ash and stuff, and just the mess it creates on their carports and their houses and
I
stuff.
mean, I'm just going off of the email I got from this gentleman, and I've had these, you know, before, and just, it triggered my memory today when this gentleman emailed me and was trying to take care of.
It's frustrating, in fact, you know, we don't issue burn permits, and so it falls under the state forestry on when they can burn, and if they have to call in and get a license or a permit number, they don't have to pay for it, it's free. Just have to get that number and record it to the sheriff's office and to your fire department.
How often do the fire departments have problems with these?
All the time. There's
And that's-
illegal burns.
I guess that's kind of where I was heading because, you know, the fire department's falling under public safety, you know.
Well, what people don't do, they call and they get the permit, which is what they're supposed to do. And what they should do, they should then follow up and call the sheriff's department to notify them they have a burn permit and they intend on burning it, tell them their address. So when Joe Blow's going down the street with his cell phone, he calls them in, that's where the volunteer.
Well,
in the call.
you don't have to have a burn permit this time of year though.
Right.
It's right the opposite.
But a lot of times, even if you don't have to, if you call SO and let them know, you won't have an uninvited guest over to your house.
Right.
With smoke coming up, so.
But Jack, the situation you're talking about, that's not just somebody burning leaves in their yard, they're burning a lot of debris.
The way I understood it, it was more or less, it was like a barrel or something, maybe burning garbage.
And it's continuous, I mean, weekly.
So if it's burning garbage, burning all kinds of stuff.
Basically, if it's not God made, you're not supposed to burn it.
Yeah.
That's the easiest way to describe it.
Yeah.
Although they can burn if it's in a barrel with a wire cover.
You can burn garbage.
Well, they can burn trash.
You can burn
And
anything, wood products.
Right, and there's certain things that they can burn, and out in the rural areas, they still can. But it all depends on what kind of ordinances or code enforcements that the county plays out.
You can't burn garbage.
We'll get you copies of the stuff.
I do it every day. Can't burn garbage.
that's about all I have on my report, and then Larry's been working very hard on the fire stuff.
Basically, the only thing I want to point out is number 5, talking to the Tennessee Fire Academy, the firefighters, I thought was the misconception they had to have SIDS training, which is sudden infant death syndrome, and domestic violence before they get their state fire commission test. But the SIDS is a state requirement. It's a state law that they have to have that. So what I did, I created a domestic violence class and did PowerPoints and got videos and stuff, and I sent that to the State Fire Commission for approval, where they would be, when they ever got this training sheet, to be able to test it, they would recognize it. And then the SIDS class, I got it from Randy White with EMS. They have a very good program they created with MTSU, and when they go through this class, they get a CU from the University of Tennessee. So, and I combined those two classes and have been teaching those, because a lot of the firefighters are going through the training. They're wanting to get their state commission certifications, and they have no way to get this kind of training. So I want to make sure that I'm giving them everything they can, or if they want to be state certified, they can get that certification. So I have been putting those classes on. I've taught one at the EOC, and then Walt Hill wanted one that was taught at their fire hall. They made all their firefighters take and go through it. And also, matter of fact, I'm going to be teaching a class tonight if I get out of here in time. During the month of September, I have been working with Denise Carlton. She is the county, the coordinator who is putting together this Get to Know Rutherford. And what they're doing, it's going to be a full-length, all-day event. It's kind of surrounding the history of Rutherford County. There's going to be a lot of activities, a lot of music, a lot of plays going on. And the volunteer firefighters and the rescue squads are going to be cooking a pancake breakfast that morning. I think with pancake, sausage, eggs, bacon, the whole works. And Miss Carlton has worked with them to get all the food and stuff donated. And they're going to be doing the cooking. And then, which Chief Walker has tickets tonight. Leave, you can buy one from him to support the firefighters. And then they're having a barbecue lunch that day, which Jim and Nick's is sponsoring the food. And I think $10, the tickets are $15. $10 of each ticket goes to the county fire departments and the rescue squads. And so this is something that is an event, kind of like Old Day Making Days, but it's about Rutherford County, the history of Rutherford County, giving tours of the courthouse and all such as that. And then, but the proceeds of the food and fundraising, it's an opportunity for the fire departments and the rescue squads to come together as a collective body and to raise money, and that money to go to their departments.
Where's the food going to be served at?
This Saturday. It's going to be on the south side of the courthouse.
Okay.
Saturday morning.
What
Starting at 7 o'clock, I believe.
And that's not going to conflict with the marathon that's running?
Well, they're going to come around the square, and they're hoping to catch some of the bystanders and spectators for that too to eat. But as far as I understand, the square is not going to be shut down. There'll be some places, parking spots, that's going to be shut down in order for them to come in and set up. But as far as going around the square, that will not be shut down.
What time's that till?
I know it's for sure it's for 7:30 to 10, and then the pancake breakfast. And then I think Jim and Nick will be here around 12 o'clock, and they'll serve through the afternoon.
So the fire, it's going to be for both breakfast and lunch.
You can get a full breakfast for $10 as pancake breakfast, and like I say, it's a lot more than pancake, sausage, eggs, the whole works. And then Jim and Nick's barbecue will be a full barbecue plate that afternoon. And like those tickets are $15, and $10 of that ticket goes to the county fire department. So Jim and Nick's is really doing it for practically nothing.
Was it going to be split up between?
Well, all the departments who want to participate, then whatever's brought in, that money will be divided separately. And Miss Carlton has done a wonderful job putting this together, and she's just been coordinating through me to get the information to the fire departments and coordinate getting them together, working together. And each department's trying to sell 100 tickets. So, if you want to buy a ticket tonight from him, or you might want to call your people who are sponsoring you or who you cover and get a ticket from them. They really need to sell these tickets, because the more tickets they sell, the more money they'll make. And they're trying to pre-sell them so they have an idea how much food They need to order.
Can somebody come up here and buy a ticket that morning or that afternoon?
They can, but what they want to do is pre-sell them so they have an idea how much
Right.
food to order.
Who could they call?
Well, I think you can get tickets at any county fire department. The rescue squads are involved in it, and I think the trustee's office is selling tickets.
Can they call you?
Yeah.
What's your phone number?
785-6809.
6809.
And I'll put them in touch with the closest department that's selling tickets.
You mentioned Jim and Nick's. They always step up to the plate. They help the YMCA a whole lot. Who other companies have helped you?
Well, I know that Cracker Barrel, Shoney's, there's a lot of people who are donating money. Some individuals have donated money. Matter of fact, the Mayor Burgess has bought 100 tickets for the pancake breakfast and was giving them to the county employees. He said, I'm going to start it off. So he wrote a $1,000 check and to show his support to get it going. And so I don't expect you guys to buy $1,000.
I was thinking of Gary though.
Gary, if you could buy 2 or 3 tickets, it'd be great. But I mean, it was just a great opportunity for the community and use this event for the firefighters and the rescue squad people to be able to raise funds. I know some of the departments have a real big fundraiser to do well. Some others don't have that opportunity. So this is a good opportunity for them to raise money. And I'm supposed to be on WGNS in the morning to interview me and talk about that and tell them, what all it takes to be a volunteer firefighter and what kind of the sacrifices these guys make to be out here doing extrication on vehicles and stuff like that. So I just want to publicize that for the volunteer firefighters and rescue squads and hopefully get people to come out and support this because this is could be a real big major event for them.
Can you call tomorrow and get that put on Channel 19?
Well, the mayor's got a commercial on there where he's talking about it.
This is something that's going to be an annual event.
This is Rutherford County.
I know, but what I'm saying though is, I've seen the mayor's commercial on there about talking about that, but I'm talking about, there's screens on there that has, I know Foster yard sales on there quite often, and Kittrell's ham breakfast on there, and Laverne's ham breakfast and stuff.
And there's flyers too that each fire department and rescue squad's got flyers. And there should be flyers up around it. There's just a whole day long event, music, everything, Civil War reenactment, stuff like that. It's just going to be a big deal up here. So, but I just want to push that for the volunteers because that's going to be a major fundraising event for them.
Check with Brian about putting it on for volunteer for the people within their fire districts to get with their fire departments about.
It just gives them more advertising.
Well, now that my commercial's over with, the next report is the fire and water report. And I wanted to let y'all know that Rutherford Volunteer Fire Department received an award from the Tennessee Fire Academy last month for the most training hours through that academy. I think they were the highest fire department to be as far as training hours, and that was off campus and on campus. I know they send a lot of they make all their recruits go through a 64-hour class before they even let them go to a fire. So they're doing, as you can see, the enormous amount of training hours that they've got on their record right here, and they want to make sure I pointed that out.
If someone, I know they're teaching the rookie school. They had a rookie school. If someone, say from Chief Walker's department, goes through that rookie school, does he get the credit for the training hours, his department, or does Rutherford get those training hours?
Well, if they go through their rookie school, I'd say Rutherford probably would get credit for it if they're putting it on because that's for their department. I know we are going to be putting one on in November. I'm going to be helping them instruct that, and then I'm going to try to put one on this spring too. The fire chiefs voted the other night to pay for that class.
Mm-hmm.
Yeah, so I'd like to get 20 to 25 students to go through that, and then after we do that, we can also add the domestic violence on there for their training where they can get to certification. But we're trying to do everything we can to help them to get the training and get accreditation for all this. And then the next one is the monthly water usages for each department. And then the training schedule for 2009, and then you'll notice for September it was the SIDS and domestic violence class. And then I'm going to sit down with our instructors and some of our chiefs here probably, and October, November, and try to start planning, scheduling of what we're gonna do, what training they wanna do for next year. Get their ideas on where they need to, train and what they need to improve on, and kind of come up with a schedule for 2010. That's all I got.
Any questions?
Gary, I had a question for Roger real quick if I could.
Yes,
Going back on some of this flooding, with the culverts and stuff that has the potential to get clogged up and some of the little streams that can get clogged up with trees and so forth, who is it that would kind of monitor that? I mean, that kind of watches out to make sure that this stuff isn't clogged up before you get into a rainy season?
Well, part of it is Public Works that we have that can go out into the different subdivisions and look at the drainages and things like that. A lot of it is the individual homeowners will call it in to the county engineer's office and say, look, we got a clogged area here, can we get it cleaned up?
But I mean, as far as a precaution though, because most people aren't gonna, on a dry day and think to call in, but I mean, when you're out in a rural area, not just a subdivision, is that something that y'all would be doing?
Well, at different times, we look to see the status of our creeks, if there's any major problems in them. But you can look today and then tomorrow, someone's dumped a bunch of trees or something. So it's really hard to have a system that would constantly check all of those. We're not set up in this county to do that, or have a department that is large enough to be able to go out and look at all those waterways and drainage systems on a daily basis.
But I mean, if you got an area that that's prone to flooding,
we definitely check
that would
them
be one to watch.
Prior to the flooding, if possible. If we know we're getting a lot of rain, we'll go out and check these common areas that flood and see if there's any obstructions there that could make it even worse. And then we try to get Public Works to come out and take care of that.
But you got places in the county like Epps Mill Road and out there by the nursing home. These little slab bridges, they'll flood out just about every time.
Okay.
Usually the road goes out and they blockade those.
Right.
So you just get ready for it. Okay.
So they do a lot of that.
Doesn't the county engineer, though, in relation to stormwater, they check some of this as that goes around, because that comes under their area.
Right,
as the
where
stormwater.
you have stormwater drainage and that. It's one of those things, it's, even in the city, it's very hard to make sure that every drain is clear and free of debris. You can check it and the next day there's something there. But I think, like on this rain that we had, our problem was so much, so quick. And back to your question when you asked about 500-year flood, I've asked that to the National Weather Service and they haven't been able to confirm or deny that yet. And there's a couple areas that I think might have reached that point, but I don't know. But we do know for a fact we did hit the 100-year.
But do you think if it got over that 100-year, some of that could be caused by the culverts and the creeks being?
It could be, but at the time, we're worried about rescuing people, getting them out of harm's way.
Okay.
And the water did recede fairly quickly after the rain stopped.
Yeah.
So that means drainage was working.
But like you say, there was 8 inches of rain in a 24-hour period.
Right.
Some places had 6 inches in 2 hours. So I mean it's gonna flood when you get that fast that quick.
Yes.
All right. Any more questions on the report?
Motion to approve the fire coordinator's
Second.
report.
Motion to approve and a second. All in favor of the motion say aye.
Aye.
All opposed, motion carries. All right. Anything else? All right.
That's it.
Appreciate it. Hey. Oh. All right, Paul's she's not gonna be here tonight. She had some other business she had to take care of. And drug court. Yeah. Yeah, I was caught going down the line.
are just my basic numbers for the month. To answer some of the questions that I think you're gonna ask, no, I haven't heard about my grants yet.
Okay.
I'm assuming I'm not getting them since I haven't heard yet.
Is it usually here quicker than
Well, I know that other drug courts around the country have heard.
they have?
Yeah. There were some emails I got today, so I'm
You would
assuming.
think they would send a notice out that someone didn't get something.
Yeah, you would. So I'm not positive yet, but I'm just assuming since I haven't heard yet. I didn't get either one of ours, which is unfortunate, but that's what it goes. And it's even more unfortunate because I got an email from the Governor's Office of Highway Safety today, and they're cutting my grant from them $5,000. So we were getting $65,000 for the DUI program, and that's being cut to $60,000. So I don't know why. She didn't say why. So that's not good.
Probably because state probably got the same problem we got, lack of funds probably.
Well, those are typically federal
Oh, is
funds. It's passed through, so I don't know. Maybe I'll hear something next week. We have our state conference next week, so I might hear more about what's going on.
Anybody have any questions?
Did two complete the drug court, or did they?
They didn't complete it.
How come?
We're having a rash of people that are absconding. I don't know what's going on. The, what was it, September 14th, we had 4 people we had to issue capiases on that didn't show up. So, and it's usually the younger ones. It's the 20 and 21-year-olds. They know they're in trouble and they think we're going to put them in jail for 10 years or something. I don't know. So it's really sad.
Mayor, do they do, if a person's had a DUI, do they go back and do drug testing on them also, don't they? They do.
You mean besides alcohol?
No, if it's alcohol,
Mhm.
they go back and they'll do, like, I don't know if you call them random drug
Yeah.
tests, but to test for alcohol.
Yes, yes.
Okay.
And other drugs.
Okay.
Yeah, and we test for alcohol with the drug court participants as well. Because usually, because alcohol is detectable in such a short period of time, a lot of people switch to alcohol after they come into drug court because they can't do marijuana and pills and stuff like that. So they start drinking, thinking they can beat it. But we are using a new alcohol drug screen that can detect alcohol for 80 hours after use. We pay $17 for it. We pay $5.75 for our drug screen, so it's just killing me that the county's paying $35 for drug screens. I don't understand that unless they're blood.
How, could you get with
Yeah,
Lois
yeah.
and pass that on?
I'll be happy to. I think we've made a proposal once, but I never heard anything about it. So
Made a proposal to Lois?
to actually Sonia Stevens.
Well,
So-
they do it through the
Carrier.
carrier clinics, and that's what they're charging, $38. So
Really?
that's where their cost is, unless they go to emergency room. That's $2 or $3.
Yeah, I'm wondering, where
Why
you doing
can't
yours
they
at?
use who?
Well, now, we wouldn't be able to do it at midnight or 2 in the morning or something. I mean, we could, I
Well,
guess.
Care
if we
Here
had
isn't
somebody on
open then
call.
either.
Well, that's true,
So it's only opened normal hours,
true.
7 to 5. You don't have one open, that's about all the times they are. And it depends where they are too.
Who does yours?
We actually send ours off to Redwood Laboratories in California, and we get them back in 3 days. But if it's positive, they do them again, and they do this gas chromatography that's the gold standard. So we know when we have a positive, we have a positive. And they also keep the samples frozen for a certain period of time so that if there is any question about it, they can go back and test them. And they will also come to court with us if anybody legally can test the drug screen.
Are you talking about blood samples or urine?
No, this
or
is
what?
urine.
Okay.
Mhm.
And how much again?
$5.75 for a 12-panel urine, and $17 for the ETG, which is the 80-hour alcohol.
And you
And
said
we're
you done
very
a
happy
proposal? What was it?
When they were asking for employees to come up with good ideas to save the county money, my assistant director submitted that. I don't know what happened with it.
Who's your assistant director?
Angie Hostella.
Okay.
We worked on it together, but she submitted it because I couldn't.
Yeah, she ought to submit it again. Let's find out what was going
Yeah,
on.
I don't know what happened. But I mean, juvenile detention, randomly test their employees and, of course, ambulance and the sheriff's department. I forget who else I talked to. I talked to several different people that.
But who does she submit that to?
Sonia.
Sonia, okay.
In HR.
Okay, and then she's got a panel that reviews that?
I don't know. I don't know what happens to them.
Gary, do you know?
I think it's Sonia.
Is it? Okay.
I think
Because that could be a big savings right there, you know?
call her, have your assistant call her tomorrow,
Mm-hmm.
and if you don't get anything out of it, call me and I'll call.
Okay.
'Cause this is a significant savings that needs to be looked at.
Well, the way that thing's set up, there's an incentive program, I think she gets
Mm-hmm.
a little piece of that pie,
Mm-hmm.
you know? And that's what the whole purpose of that was
Mm-hmm.
formulated for.
There's a reason.
Yeah, I think she would have told me if she'd heard anything, and she hasn't heard anything, so.
And there's always two sides to every story. I mean, it may be something here that we don't know about,
Yeah.
or she may know. I don't know.
Insurance companies may not be safe.
Maybe.
Yeah.
I mean, there may be a good reason to, that we don't know.
Yeah.
Anybody have any questions on the drug court?
Motion to approve the report.
Got a motion and a second. All in favor of the motion, say aye.
Aye.
All opposed? Motion carries.
Okay, thank you.
Thank you.
And I'll get back to you on that.
Okay.
Okay, thanks.
All right, before you, we've got, Wiltax report. He could not make it tonight. And that's it. Motor vehicle, Wiltax report. And I think somebody asked earlier about the number of schools that, on the wheel tax. And it doesn't look like they're all complete here. I think this is. $457 violations, and that's not all schools. And that's not all students. That's just new registered.
That's since
students.
school started.
This is
Yeah.
since school started. So it appears that our endeavor has been favorable. There's been people out there that have were in violation that are in the process of getting things taken care of.
Or are they? How do we know?
Well, from what I'm understanding from Bart is he gives, once the numbers are turned over to him from the school board, he gives them a letter, gives them 30 days to comply. And once they don't comply within 30 days, he stops them in court. From what I understand from him.
Well, I see, okay, on the first page, or second page, it's got behind his cover sheet, it's got wheel tax violations. Is that the ones he's charged?
I'm sorry, I'm not following.
Okay, page after his cover sheet, it's got wheel tax violations at the bottom. Is that the ones he's actually cited? The others, the 457 are still in process, and then 44 of them have been cited. And it could be for other reasons too that they get cited, but for that they may not be just the school ones. But I guess my question is, are we seeing results? Because it's the end of September. School started back in
August.
Yeah.
Well, see, this is August. 09's report.
Mm-hmm.
So that's going to have to be a question that Mark's going to have to answer. I don't know.
So Gary, what's the process? And if he's at, say, Laverne Lake Middle School that's on here, elementary, he's gonna send them a warning letter. Is that,
Once
they
he-
need to get compliant?
Once he receives the information from the school board, he is sending them a letter for them to get in compliance.
So he's not out there on the campus
No.
driving?
What we,
school.
what we did, and I'm sorry, this.
Well, I remember that y'all had
Yeah.
asked the school board to look at.
We'd asked the school board and, to go and actually check vehicle registrations when someone registered their child, in our county schools. And then they would turn it over to Bart, which Bart was gonna be the, enforcer, of this. That way we wouldn't have school, people enforcing it. He would be the one enforcing the measure. And they were, when they turned that stuff over to him, they were doing it weekly or bi-weekly, and he was in process then of sending letters to these people.
Yeah.
For them to get in compliance.
Okay.
And the last meeting we had, he said it was roughly about right at 500.
Wow.
But the schools started getting these back in July, because when kids registered, they registered before school
Yeah.
started.
So it could be, I mean, I'm speculating, I don't know, it could be that when he did last month, there was that meeting,
Yeah.
and this could be an additional. I don't know, that's a question
They
that.
could have been the ones just in August after we met.
Well, it
last
says right
month.
there on the back part of it, it's an increase on the wheel tax, $7,810 more this year than it was last year.
For the month, that month, wasn't it?
Yeah, for August.
So,
Well, I'll run into it.
yeah, that,
Just that one, though. But that you can't do much about. People aren't
Yeah.
buying. You're not getting
Yeah.
new titles.
Well, next month when Bart comes, we can ask him these questions. So.
I don't think this is a matter of people trying to avoid, and yes, there are some probably are, but most people don't realize they moved here from out of state, so they just bought their tags in the state they came from. They're good for a year, well, they're assuming they're good for a year, which they're not. Once you move in the state here, you've got 30 days
Yeah.
to change your license.
Well, you move here from out of county, state law, that you got 30 days.
I don't think a lot of people are aware of that, and that's probably where we're seeing objection.
But you know, and I agree with you, but you know, I want to applaud Commissioner Farley and Director Gill, because $7,800 increase right there.
Well, I didn't do it by myself, I'm not gonna.
No, but you pushed, I mean, and I'm not picking on you or give you a bad, hard time one way or another, because I think it's a good thing. You know?
Well,
But that's $7,800 increase right there.
Well,
That's
I don't-
$7,800 we didn't have.
Well, I don't wanna go, I mean, I think there's more commissioners that push for this as well, and I'm not gonna sit here and, I don't wanna take there's others that actually push this thing as well as.
But that can be an unpopular thing right there, because it ain't that you want to cite people, but if we're educating our child, they need to be paying taxes.
Right, and there's a number of people out here that, I even had people, when that was going on, people would call and say, hey, I'll stand in line and write down license numbers at the school if you want me to.
Yeah.
And I had one lady that was in my district called me and told me, she said, I know 22 of them at a certain school.
Yeah.
And Bart went out there the next day, there were 22 of them out there in line.
But also, he put it on Channel 19 a long time ago about the law, about the 30 days that's been on there. And a lot of new people that move here often look at that channel just to find out what goes on in the county.
And one thing too, and a lot of people, it's the emission testing. That's another thing where a lot of people get, may have a Bedford County tag, a Warren County tag, or something else, because they try to get away from the emissions. And so.
Well, man, that stuff's kind of sad, because a lot of those people that can't pass emissions don't have the money to fix it, and they're driving an older car, and some of that stuff's it may be $500, $800 to fix an old car.
All right.
The one thing along that line, that's one thing we got to be careful of, is our wheel tax, because if we keep increasing our wheel taxes, people are going to go out. It's going to motivate them to go outside the county to do that.
Wilson County just implemented.
No, I'm just saying we're one of the highest.
Yeah, Wilson County just implemented the wheel tax over there, so It's gonna cut.
How much is theirs, do you know?
I think it's $26. About.
Well, I know the clerk's offices are, it's a state law that if someone has they gotta have a address in their county for them to sell it. If they don't, then it's against the law. Some of them enforce it and some of them don't. So. All right, is there any questions on Bart's report? If there's not, entertain a motion.
Move to approve.
Second.
And a second. All in favor of the motion, say aye.
Aye.
All opposed, motion carries. And next month, trying to forget, we can ask him if someone may want to give him a call tomorrow or whatever, to answer some of the questions if you'd like. All right. Any other business come before the committee?
You're gonna make the pause before you gonna do
No.
anything? Oh.
I told her not to worry about bringing it up here tonight, to take care of, make the call.
Okay, got it.
She was by herself making the call.
Okay.
All right, we stand adjourned. Thank y'all.